All right. Welcome, everybody, on this Wednesday, March 20th. Happy to have you here. For those of you who are joining us, I have the wonderful, the one and only, I'm going to call her Super Mom because she definitely sounds like one after talking to her today. But I want to thank some of our attendees rolling in. I see you, Jonathan Wayne. I see you, Chris, Julia, Sarah, Sapita, and Shanita. Happy to have you guys on. And for anybody else rolling in, welcome to one of our Beyond Marketing Power Partner webinars with CBM Medical Management. Before I hand the baton over to Miss Rebecca Andrews, just want to share a little bit about who we're talking with today. Rebecca Andrews is the founder and owner of CBM Medical Management. In 1984, as a single parent at 19 years of age, Rebecca embarked on a very transformative journey from the bayous, I'm saying it correctly, from Louisiana to Dallas, with a lot of barriers and obstacles in life. And despite, starting from scratch, she was able to work at Presbyterian Hospital, navigate through the academia there, and medical and administrative roles. And amidst those challenges, she laid the foundation for a future, leading to the culmination of CBM Medical Management in 2000 after she was laid off. And she has named it after her three children. There's a C, B, and M there. And she's leveraged her experience to focus on RCM and scheduling for mental health clinicians. It's a full circle moment for her, from her humble beginnings to leading a successful team and being a big player in the mental health space with a lot of our clients, providers, and fellow colleagues around the country. Rebecca, thank you for joining us today, and we're happy to have you here.
You're welcome. I am excited to be here. So I'm going to get started with my slide deck here. So give me a minute and I'll share my screen. Perfect. Can you guys see that?
Yep, I think we can. We're all good.
Awesome. Good. Well, thank you so much for that wonderful introduction. I feel so humbled. But the one thing I am proud about is CBM and my C, my B, and my M. And as we were talking a little bit earlier, the C has joined the company recently, and I'm super excited about that. And B, it's already been a part of the company for almost 10 years now. So we're just holding out for the M to come and join us. I think he'll get there, but it's been a minute. So
what are their names, if you don't mind me asking, Rebecca? You said CBM, right?
I don't. I hope. I know one is actually listening in, and so sorry, I'm going to embarrass you, but Christopher is my C. Okay. And then we've got Brittany, that's my B. And Brittany started working for CBM when she was 8 years old, learning how to type in the codes on the keypad as I worked out of my dining room. And then we've got the M, who's Marcus. And he's doing super well. He's in oil and gas, and he's blowing and going there. So medical is not on his radar yet. But I'm looking forward to the day that it is. But he's a great, he serves on our board of directors. So he gives me awesome advice about things that I should do and, sure, things I need to engage in. So.
Sure. Well, with Christopher and Brittany, I'm sure we'll nudge Marcus in the right direction at some point. But thank you for that, Rebecca.
You're welcome. You're welcome. So I want to tell you guys a little bit about CBM and what we do. This slideshow is just expected to, give you a little bit of a glimpse of who we are. So I am going to get started. I will tell you this. I've got about 40 years of experience in the field. Hence the gray hair. Dr. Narwhal kind of told you a little bit about my background, which is totally true. It was definitely challenging coming from the bayous of Louisiana. Being a mother at 19 years old wasn't the plan that my family and my parents had for me. And I was a single parent. So, I don't have to spell it out. I think you guys know what that means. And going from that type of in that time stigma to doing all that I did, that actually was a driving force. I was very determined to not be a statistic. And I even taught that to my children that, as we were going through that phase of being a single parent, we were on our own. Look, we have to grind. We are not, because we might be in this arena doesn't mean that that's where we stay. And I teach that to my team right now. It's okay that you don't know something today. It's not okay that you don't know it tomorrow. So having said that, we got busy in that dining room and started telling people about us. So who are we? What do we do? Well, we've got the 40 years of experience, as I mentioned, primarily in mental health. Most of my service has been in the hard knocks, boots on the ground, mental health. Our tailored services are all around making sure that our mental health providers are getting the best revenue cycle service from us that they can get. And that entails a lot that I'll get to a little bit later on. Our mission is to boost psychiatry success. That's what we want. I know I think it was the M of my children, oftentimes would ask me, why do you focus on psychiatry? Why do you focus on mental health? And based on his research, that was one of the lowest paying specialties that was out there. And that's true. We're not at the top of the food chart when it comes to, specialties that are out there. You've got your surgeons, you've got your cardiac thoracic surgeons that are just out there and they're making some longer dollars. And I told them that's exactly why I wanted to be a part of the psychiatry society and to be the person that would help these providers find their success just as much as all of these, the surgeons and things like that. And he was like, I'm not sure. But then when we started doing it, he was like, wow, you really are doing it. So our goal with that is to be a nationwide impact. We want to service, and currently we do service several providers all across the United States. We are committed to excellence. Every aspect of our service is designed with your practice success in mind. Two of the mantras one mantra, I guess, two of the key words that I teach my staff on a regular basis, we talk about it in every meeting that we have, is that they are called to do their job with diligence and they're called to do it with excellence. And to me, diligence is just like in my early days and my early start, you don't quit. So, all right. So what are our core values? Well, empathy and understanding. We understand and we believe in the power of understanding the challenges that mental health practices can have, as well as patients. Because of our virtual assistant side, and we'll talk more about that, we actually get to hear a lot of the challenges that patients are having with accessing mental health. It's more along the lines of treatment of certain diagnoses or time or date or different other criteria that are important to them. And so we approach that with a lot of empathy, a lot of understanding. Integrity and transparency. Our foundation lies in honesty, transparent interactions and operations, ensuring trust and reliability. Listen, it's too hard. It's hard work to be dishonest. At least it is for me. That's not something I want to pour my energy into. If it means that I got to tell you the hardcore truth and it's not pretty, then I'm going to tell you the hardcore truth. There's even been situations where providers were concerned about something and we just had to tell them things that was stemming from their end that was creating the bridge that they needed to cross. It was creating a hurdle. And they just simply needed to walk across the bridge. And so we will walk across that bridge for you. In some cases, we even build the bridge. So our innovation and excellence just simply means we're committing to leveraging the latest technologies and the best practices to deliver superior services. Our support and empowerment I would say that's our secret sauce, and you'll hear more about that later. Our goal is to create financial peace for our mental health providers, so it empowers them to focus on patient care. Community and partnerships is part of our core values. We see ourselves as an integral part of our client's team, and that's huge for us. If we feel like we're not a part of the team and we are an outsider, we typically will take some action around that. And we'll get into what that means a little later. So I think I went backwards here. All right. So our comprehensive mental health solutions. We bring the full plate of services to you guys. That's our goal. Obviously, revenue cycle is our top service. That's the one that we feel like we definitely are good at, the one that's needed. Virtual assistants is definitely a place where we have thrived and been able to help several providers. We offer TMS profit strategy consulting. So if you're looking for, my TMS practice has been thriving, but things have kind of slowed down a little bit. I'm interested in seeing what can I do to boost it. Well, first I would ask you, have you contacted Beyond Marketing and gotten in connection with them for some good leads? Because 9 times out of 10, that slowdown is probably connected to leads, the lack of the leads or the lack of working those leads. And if that's all taken care of, you're already signed up with Beyond Marketing, then I'm going to say, okay, well, let's talk about what are we doing and what other services that you can offer that's going to boost your TMS practice and going to boost your TMS treatment to your clients and in the community. And you will do that consulting directly with me. Then we offer front desk services. That's a part of our virtual assistant. That solution has been extremely successful and very beneficial. We also offer patient acquisition. This is something very similar to what you get if you sign up with Beyond Marketing. You're not going to need that service from us, because they will teach you and take you through the patient acquisition piece. If you find you need additional help after you have already worked with Beyond Marketing, then we're here to support you as well, probably by partnering with them. All right. So why does CBM stand out? It really, I think for us, what it really boils down to is being a partner. And I said that earlier when I said being a part of your team. We are a partner. We want to be a partner who understands the nuances of your practice. And we understand that Dr. Elliott's practice might be a little different from, Dr. James' practice. So we want to understand the nuances of your practice. We're committed to that. And then we take those nuances and we build up a process that can help you grow and help us both be successful. Obviously, with 40 years of experience, this is what I will brag on about today. You guys, it's very hard for me to talk about myself, but I am super proud of this. And that is 90% of my business, 90% of my business over the past 24 years. CBM turned 24 years old, January the 22nd. Over the past 24 years, 90% of my business has been by referral. So I'm new at this marketing thing. I've not ever really had to go out and market, because most of my clients will tell their clients, hey, you need a good biller. You need somebody that's gonna, that's knowledgeable. They're gonna stand by you. They're gonna go through the hard times with you. They're gonna dig in and figure out where you can do things better. And they're gonna help you walk through getting better. Then this is the place you want to go. So I am very, very proud of that, along with the fact that most of our clients stay with us for a very long time. I've got one client right now that has actually been with us for 14 years. And he's determined and committed and recommits every time we talk that, listen, I'm approaching retirement age. I am riding this out with CBM. So it's been very, very successful with our word of mouth marketing. And y'all know doctors don't refer folks that's not going to do a good job. All right, let's see if I can get this going in the right direction. So, empowering practices. This is what we can do for you. I think you can kind of see it all, but to sum it up, support. So there's that word again. We partner and support. Those are two things that are very, very important to us. We typically will build a dedicated team or dedicated staff to your particular contract. We're insurances. I would say we're insurance experts. That's something that I've studied a lot. I've trained my team on. We're constantly training and working on knowing the insurance guidelines and staying abreast of all the changes. Your revenue management. We love to optimize financials with revenue management. One of the ways that we do that is with our analytics. We can create reports that's really going to give you a very clear picture on where you are, or use reports from your system to help you understand where your practice stands financially. And administrative freedom. We've experienced so much positive feedback on this one. We manage your calls and scheduling. Guys, listen, when you are just starting out, you're solo, you got, maybe one person, maybe nobody. Maybe it's just you and you just hung out your shingle. It is next to impossible to answer the phone and treat patients. But if you give CBM a call, we will put together a package that's ideal for you, and we manage those calls and we schedule those appointments while you're focusing on that patient care. And that will make a huge difference in your practice. We've got people that will say that to you all day long. And we also have our customized solutions, those particular services that's tailored for each provider's practice. Our impact. These are some big numbers, but they're accurate. I mean, over 40 years between me working in other practices and working in my own practices, we have come up with 1.5 million claims that's been settled. We've scheduled over 500,000 patients, and we've collected over $1 million for our clinicians. Very proud of these numbers. Came with lots of hard work, lots of late nights, but in the end, it was worth it. You guys get a sneak peek of some of the testimonials that our clients have actually rendered to us. I'll tell you a quick story about Terry Abraham. I love this lady. She is so real. She's a therapist. She runs a therapy clinic down in Georgia, I believe. She's in Marietta. And she was our client, and she got a better offer. She had been our client for quite some time. It was working out great. We had run into a few little kinks. We worked them out, but she got something that came across her plate that was a better offer, and she just couldn't refuse it. And I understand that. So we wished her well. We supported her. She left, and she went off. And she did well for a while with this other setup. And can I tell you today that Terry came back to us in January, and she said it was good while it lasted, but they weren't CBM. So this is what we do for our providers. This is who we are. So let's see. So looking forward, we are looking forward to expanding our reach. We're looking for some innovative partnerships. We're looking for continuous improvement, and we always do that because we are constantly training. Even at this stage, I'm still going out and embarking on training and looking at ways that I can get better and reading and we're looking for some empowering providers that we can actually partner with to help you grow your practice. And that's something very important for us as well. We don't mind a client that's saying, like my 14-year-old client that said, hey, I'm riding away to retirement. We will support you as well. But currently, we are looking for practices that want to grow and want to expand. That is our desire at this point. So we've got a little freebie for you, for those of you that have attended today. So if you would go to CDM, medicalmanagement.com, and just click on the link there, it'll take you to this little free download, evaluating your clinic's performance by using KPIs. I'm a huge proponent of KPIs. We are constantly tweaking our own to evaluate our own business. And we'd like to offer you just some input that I've put together on what I've experienced with evaluating my own business and helping some other clinics evaluate theirs. So why don't you go to CBM today and click and get your free copy. And that's about it for me.
That was awesome. Wow. Rebecca, I have to say, you've really summarized that in one of the most effective ways possible. And what I love is that you emphasize the importance of quality over quantity work, which I think is something that's unsaid in the mental health space. You know, you made a great point earlier about psychiatry being one of the least reimbursed fields. That's been changing though over the last 2 decades for sure. But part of why it's changing is because of the quality of work that's being done, which is also reflective of what the quality of the interactions we have as a business with other vendors and partnerships. So that definitely, is something that I find very, very appreciated and definitely comforting to hear on my end. Yeah. With that said, I want to say thank you for those slides. That was very informative. And for those of you interested in downloading that, the free book, that discovery call workbook that she has on cbmmedicalmanagement.com, please reach out to us after today's call, and I can forward you to Rebecca, and she can have you go to their website and check out that book as well. Now, time for some questions, because I heard some things and I wanted to really dive into it with you and see if we can get some questions out. And for those of you that are listening, and if you do have any questions, please enter it into the Q&A chat box that we have on the bottom of this Zoom webinar, and I will have those questions answered for you. With that said, let's dive into the KPIs, because I love that you talked about it. And I think it's important for any clinic owner to understand the importance that even if you're a psychiatrist who's one of the most academically credentialed psychiatrists or a counselor who is well known in the community, that's great and all, but that doesn't mean patients will walk through your door. That doesn't mean you're going to get claims paid just because you submit them. It doesn't mean you have the best front desk services because you hired someone to answer your phone. So what are some of the key performance indicators that you focus on to measure success and identify areas for improvement when it comes to your clients?
Oh, that's a great question. And I love that question. So the number one for me, my favorite, is tracking denial trends. Mm-hmm. That will open up so many doors of ahas for you. Because when you get to dig deeper about, okay, well, why is it that every time I bill a claim to Aetna and I'm using an F32 code, why is it denying? One of the things that we do on a regular basis, we kind of set up our providers for success in this area, because one of the analytic reports we automatically provide most of our providers every month is a denial trend report. So if they would just take those denial trends and really dive deep into them and look at the why under the denial, that will open up so many doors of areas where you can improve in. And that's really important. Along with the denial trend report, most people, and probably a lot of billers, would probably be saying the collection ratio or the collection percentage. You know what? That is important. However, if your collection percentage is that's The word that I want to use, it can almost give you a false positive, you know?
That's a good way to say
You
it.
got to make sure that you're looking at the things that are really important that will feed directly into that collection percentage. And your denial trends is the main one. The next one is your rejections. Why are your claims rejecting? Are they rejecting at the carrier level? Or are they rejecting at the clearinghouse level? And those are two different types of rejections. If they're not even getting to the insurance carrier and they're being rejected at the clearinghouse level, then do you have a clearinghouse issue? Or do you have a data entry issue that could have started with the front desk? It just tells you so many, it opens up so many windows of opportunity for you to learn more about your practice and how you can improve. And it's important. I think it's so important. And you look at it from that perspective, with that lens. Because when you start looking at things about, well, where did I go wrong? Or where did my billing company go wrong? Or why is my billing company not performing the way that I need them to perform? It could be that it's not really about the billing company at all. It could be that the data entry that has been put into the system by your current front desk staff, it's not their fault. We're human, we make mistakes, but maybe they entered in the code for the insurance that's not the ideal code for that particular patient's insurance. Well, when that claim goes over to the clearinghouse, if the insurance information is not right, the clearinghouse is going to kick that claim back. And if you're lucky, let's say, if you call this lucky, and that claim gets to the insurance carrier, then they're going to deny it. You're still in good shape because we're going to track it on the denial trend side, and we're going to be able to tell you this is something that's happening, and you need to look further into it. A little education, a little training, and you're able to improve those. But my favorite KPI, denial trends.
Denial trends, interesting. So touching on that, and I want to ask this question as if I'm walking into this as a deer in headlights, right? You mentioned the word denial and rejection. What is the difference between those two?
Oh, that's a great question. So a rejection is basically when you send your insurance claim, you hit that send button from your EHR, and it's supposed to go to your clearinghouse. Mm-hmm. Your clearinghouse then is now responsible for receiving that electronic claim, opening it up, and reviewing it to make sure that all of the data in that claim is accurate, and it's clear, and it's concise, and it all matches up. Well, that is a clearinghouse rejection. Okay? That means if something in that claim is not matching up with the components that the clearinghouse needs it to match with, then that's going to be a rejected claim. It's going to be sent back to you in the form of a rejection. An example of that might be something as simple as Wilma Andrews. Well, maybe the front desk person typed in Wilma as a male. Okay. But Wilma, according to her driver's license, is a female. Well, that particular claim for Wilma will get rejected if she went over there as a male, because according to everything else that's on the claim, she's being seen for female issues. She's got some concerns and some depression, some postpartum depression. Everything is going to indicate that she's a female. So that kind of claim could get rejected. I've even had claims reject because of zip codes. Kind of weird, but I've had them.
I've had that too. I've heard about that. It's happened in our office quite often, from address, zip codes, small little insignificant details, but turned out being very significant at the end. Yeah,
exactly. Because every time a claim rejects, you can count at least 1 to 5 days of a slowdown in your payment. So think about that. And if you are getting 10, 15, 20, 30, a whole batch of claims rejecting, then that's a problem. You know, one of the other most common rejections is payer ID numbers. You're using a payer ID number that you had a year ago. Your system has already got it in there. You hit send. You didn't even think about it. The claims get rejected. Well, now you found out their ID number is not any good based on the rejection message that you got. So I think we're clear on rejections. Moving over to what is a denial. A denial is when an insurance company has received your claim and they have refused to pay it based on something regarding their guidelines with that claim.
Gotcha.
So one of the things I want to make clear, though, and this is something that we oftentimes go through training with some of our newer providers that's just getting started, is that if a claim is processed toward a deductible, that's not a denial. It's processed. It's finalized. That just simply means the patient has to pay that amount of money out of their pocket. One of my stupid but favorite denials is duplicate claim. They will deny your claim because it is a duplicate claim. One of the ones quite popular as a denial is that I've seen that claims have denied because this patient saw another provider on the same day as your claim came through of the same specialty. And so that's a denial that you might have to fight. We've got lots of interesting denials.
That's so unfortunate to hear for somebody who's doing their, Hippocratic oath to see a patient or a client or whatever the case is, and they're not aware this patient went somewhere else. Now their claim's been sent there, and now they're not getting paid for their services, their time. So that's very unfortunate. You mentioned clearinghouse. We use, I believe it was Ability in the past, and there's a couple of different options there. Do you have any preference towards the clearinghouse that you worked with, or you use?
Well, we use TriZetto. We have a billing software, and with our billing software, it automatically came with the TriZetto clearinghouse. I do favor TriZetto. It's got the bells and whistles that we need to allow us to show up for our provider in a quick and efficient way. And it's just I like it. My favorite thing about it is that it just gives us a list of all of the payments that's come in 1 month. So it makes our job of being transparent to the provider with what payments came in and how we're charging you and where we're getting our monthly number from very, very transparent, because it is TriZetto. There are other ones out there that offer something similar, but my favorite is TriZetto.
Awesome. Another question I have for you. Do the systems that you have in place for your billing SOP, do they seamlessly integrate with common EHR platforms that some clients may use? Is there something that we do there, or is that something that's separate?
Well, I would say that it integrates. We typically build a bridge. So we use a billing system called Practice Suite. That is our preference. Practice Suite. Also, they partner with TriZetto. So whenever we get a new provider and we add them into Practice Suite, TriZetto kind of comes along with that. So we prefer that. However, matter of fact, we just did this for a client. They wanted to continue to use their EHR that they were using previously, but they wanted us empowered to do the best job possible for them. So they had no problem with us using Practice Suite. So we build what I call a bridge. It's a process bridge of how we can seamlessly work together. And it all comes out together just fine, and it works beautifully. It's just like you've got one system.
Sure.
I will say this, though. There are quite a few of our providers that want us to work out of their system, and we have no problem doing that.
No problem doing it. Okay. Awesome. We appreciate that. And that just shows how objective and how much of a partner you are, because, we have our preferences on the practice side, right? And I'm sure you understand that. Yeah. We're a little high maintenance sometimes, right? It's okay, Rebecca. It's all good. So a quick question then, and I'm sure a lot of our guests are listening, and those who are listening to this recording later have this question. How do you structure your pricing and fees for your mental health billing services and even your front desk services? How do you structure that? And again, I know there's certain tiers and how that works, but how would you kind of summarize that?
Well, quick and easy answer is revenue cycle side is primarily by percentage.
Okay.
And if you want any kind of virtual assistant services, front desk services, we charge by the hour. Now, that's been a change in 2024. We were previously on a flat rate with our virtual assistant services. And because of the demand in what we pay our virtual assistants, and I will just stop and give a real plug, we do use offshore folks for our virtual assistants as well as Americans. If somebody tells us they want an American, we're going to get them an American, obviously for a much higher rate. But we will use, or we primarily use our go-to, our offshore virtual assistants. These are people that we source for, we hire them, we vet them, we train them. They have to go through 30 days of training. 6 weeks in some cases, depending on what we're training them to do. They get checked off that training by me before they get turned over to the client. And what we found, in order to get the best of the best type of virtual assistant that we want for our clients and for our team, we have to pay a bit more. And so that is what has transpired into us charging a bit differently than we did in the past. So now we're at an hourly rate for virtual assistants.
Gotcha.
And all that information is on our website as well.
And as far as a training for anybody that's domestic or international, it would be the same type of training for both, right?
It's the same. It is the same.
Okay, perfect. So then let me ask you this, going back to some of the billing discussions, because the front desk stuff, I think that's, a separate conversation, but nonetheless, it's important to talk about. And I know we could talk about this in a later call, which, for all of you listening, Rebecca and I will do these calls again at this at some point this year. So be aware, we're going to talk about more detailed conversations. But for today, what are some of the steps that CBM Medical Management takes to streamline the billing process and kind of minimize those denials and those rejections or delays for your clients?
Yeah, that is a really, really good question. So I would say the very first thing that we do that I'm super proud of, kind of giving away some of our secret sauce here, but hey, we're in good company, right?
I appreciate that.
We vet the provider's insurances before we bill out one claim.
Gotcha.
That's the first thing that we do. And we found this to be so very helpful because so many times we had providers show up on our doorstep. And of course, in the process of getting them onboarded, you ask for what insurances they've got. We ask for fee schedules. And then we take that information and we go out there and we just started billing at one point, only to find that what the insurance carriers or what the credentialing department or person told this provider that they were in network for, we found by billing out the claim, they weren't.
They weren't. Okay.
And so we learned, you know what? We need to vet all of these insurance carriers that is presented to us so that we know going in that we're going to be able to get a 99, 98%, 100% first pass rate on claims, and they're not going to be denied because the provider is not in the network. So that's the number one thing we do. So we take the time out to vet all of their insurance carriers. The second thing that I'd say that we do that's been very successful is we build up a scope of work or a scope of procedures for each and every one of our clients that we sign on. This is how we're able to build up a process and a team that works for your practice. So you're not a cookie cutter. Whatever Dr. Shamali might have, you may not have because you don't need what Dr. Shamali needs. And this has been extremely effective. It gives you full transparency of what we're doing and how we're doing it. And we even include contact information. So all of the folks that's in charge of these different positions We've got people in charge of the collections department. We've got people in charge of the insurance verification department. You get their contact information. So then if you've got an issue with that particular department or something comes up, you go directly to that person. They take care of it. And that's been very successful. Very successful for us.
I appreciate that. That's really good to hear because, again, you use the word cookie cutter, right? We don't want to go down that road and become an assembly line type of service. And I think at Beyond Marketing, we share the same sentiment. We are not trying to replicate the same concept or ideology and deliver it to our clients and say, do these things. No, each client is very specific and unique. And from a billing standpoint, there are certain things that stand out. Two more questions from my end. Anybody else that has any questions, feel free to ask them into this chat box. I feel like if the questions I'm asking are sufficient, so I don't have any there, that's great. I appreciate that. So two last questions I have, then we'll leave it for some open discussion for anybody else that wants to jump in. This is a question we hear very often, right? It's I call the ketamine space the wild, wild west for two reasons. Yes. Number one, I see everybody who's in this space, most people I've seen in the ketamine space have this preconceived notion that, I'm going to start a ketamine clinic because it's super successful. I'm going to make tons of money, not realizing that we are still in the US of A. There's some socioeconomic things going on. This is not FDA approved, so it's a bit of a wild, wild west. So with that, a lot of clinics open up and they offer ketamine and they're super excited about it, but then the patient flow is such that it takes time to nurture that process and bring patients in. So a question I'm asked often is, how do I get reimbursed? And I know we didn't talk about this question before, Rebecca, but it just came into my mind, so I wanted to ask you about this. What are you seeing with reimbursement for ketamine during this time we're in right now?
Well, there's two things, and I'll just say it. IV ketamine is not approved by insurance carriers right now.
Correct.
So, I just want to put that out there. Yes, go out there, start your ketamine clinic if that's what you want to do. I want you to go and achieve your dreams. Let's put together a strategy about how you can be profitable in that type of clinic, because it is possible. Not without hard work, not without marketing. And you got to start with the marketing.
You guys start with the marketing.
You got to start with the marketing. So I just want to make sure I'm setting the right standards here and the right expectation. IV ketamine, you cannot bill insurance companies to IV ketamine. Your patients cannot take a super bill that you give to them and go and submit it to their insurance company for them to get reimbursed, because it's not a reimbursable item. Now, can they get paid from their HSA or FSA or whatever? Possibly, but that's between them and those particular entities.
Gotcha.
Now, Spravato, that's a different story. Spravato, you can absolutely be paid by some insurance carriers. Spravato is very closely monitored by insurance carriers. You do have to get pre-certification for Spravato. And a big part of Spravato is going to depend on whether or not you are buy and bill, which means you're your own in-house pharmacy. And that's another topic of conversation.
Yeah.
That you could probably spend 2 hours on just by itself.
Yeah.
But if you're not going to be buy and bill, then primarily the prescription is going to be written just like you write a prescription for an antipsychotic or something like that. The patient gets it filled, they bring it to your office, it's administered by you and your staff, and you get to bill for observation codes, office visit codes, things of that nature. And the wonderful thing about Spravato is that you can get what I call a block of visits. So that can be used. So just make sure that you understand what you're getting, and make sure you know the TMS, the Spravato guidelines, the clinical policy guidelines. That is super important.
Right.
Because you do have to follow those guidelines. And the one big thing I'm going to tell you, document.
Ooh. Preach. I love it. That's what I want to hear.
Document, even for IV ketamine that's not covered by the insurance. That doesn't mean that you don't get to create a note for that patient. Please create a note for that patient. Please create the same type of note for that patient that you would if you were rendering them any other type of service, whether it's psychotherapy or whether it is a psychiatry medication management visit. Please, please, please document your notes. Be thorough. Make sure your notes tell the story. Because if not, there will be people coming to knock on your door asking you to tell them the story and pointing out the missing parts of your story. Mm-hmm. And you will then have to prove that you did actually walk out all of the steps of that story. So start off with a complete note. That's so important in this day and age. Retro review is a real thing, y'all.
Yeah, you are so right on. Rebecca, I really appreciate you saying that, because in healthcare, we underestimate the importance of documenting everything. I know we're taught that during our training in graduate school, med school, nursing school, whatever the case is. Documentation is key, not just for clinical best practice, but operational best practice. And it applies on both ends. I totally agree with you there. And just for context, with TMS, I find that some clients and providers and colleagues I've talked to have had this question, I'm not a network with this insurance. Do you agree that there is a strong power in the single case agreement in TMS, and that's something that everybody should consider as a TMS provider?
I do.
Yeah.
I do. And we have. Because listen, if a patient qualifies for TMS and you can prove that they qualify for TMS, it's non-invasive. It's a no-brainer.
Oh, it's so easy. Thank you.
People don't remember to take their medication, y'all. That's why we're talking to them. I mean, that's why they're calling. That's why we're dealing with them at the grocery store and at the gas station. And when we're calling for services, I mean, a lot of these people out here are struggling with some sort of mental disorder. And guess what? The stress between trying to get up and go to work when they haven't slept all night, because they can't sleep all night because they're psychotic and they can't sleep. So why not try to, if they qualify, why not try to get them into TMS? And yes, go for that single case agreement. And I will tell you another little pearl, as I call it.
Yeah, nice.
If you're out of the network and you're having to get single case agreements, immediately get your credentialing representative to get a contract submitted for in-network if they are accepting in-network. It's even more powerful if they submit the application and they tell you that the network is closed. Because now, guess what they just did for you? Now every patient with that insurance, you're going to be able to get single case agreements for. Because
it's super easy. That's super easy.
Guess what they're going to do? They're going to show up in your email asking you if you would like to become an in-network provider.
You're on the radar. You have the correspondence. The due diligence has been done. You're in a good space to push things in that direction. So that's fantastic. I love hearing that. Last question before we wrap up, because I know we've talked so much today and there's so much more we could talk about. Right? No, 100%. Do you often have clients who are not able to see the holes or leaks on their end, if you will? Is that something that you come across pretty often? I know that because I love our clients, love working with my colleagues and fellow providers. And sometimes I ask myself, do you understand what you're doing? You're kind of self-sabotaging. And, it's something we bring up. For example, TMS, if your hours are only between 9 and 5, good luck sustaining in that space, because it's a very time-sensitive treatment where you need to be accessible and accommodating. So to that question to you with clients, when it comes to the revenue cycle management, to front desk operations, do you have clients who aren't able to see those leaks and holes?
Oh, absolutely. 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 It's hard for them to see because it's typically something that, they're prideful, and I don't blame them at all. They've worked hard. They went to school. They got the degrees. They did all of the hard work, and now something is not working. And if they primarily have staff that is in office, and you have to give them a report about this particular leak is happening because your staff is doing X, Y, and Z, or not doing X, Y, and Z, it's hard for them to hear.
Sure.
Nonetheless, we have to say it to them, because at the end of the day, it is not good for either one of us, and it can really affect the relationship.
Agreed. And that's what I really appreciate hearing from you, Rebecca, because we're in the same space. You know, we have to have constructive conversations with our clients. Hey, this is why we're not able to get to that next step or next level, and this is what's holding us back. Let's work with you on this. And that's what we do as growth partners. I think beyond marketing holding that role, CBM medical management holding that role, it's a team effort. And part of it is to interestingly look at what's being done and how effective it is. And that's a big part of it. With that, I know we're a little short on time. I don't want to, keep the conversation too lengthy today because there's so much information shared. Let it marinate, let it digest. With that said, Rebecca, I can't thank you enough for this call today. This has been so informative for our clients listening. Thank you for joining us. If you have any questions, if there's anything you'd like to ask us further in this, based off this conversation, you can go to www.cbmmedicalmanagement.com. Please check them out. They're an awesome group. They're a family, literally, which is also awesome to me. And for what it's worth, we're grateful for the work you do and to help our fellow clients and people in the space get better, Rebecca. Thank you so much.
You're welcome. And thank you. Thank you, guys. I really appreciate what Beyond Marketing does, because you do really provide great qualified leads. And that is so important. Without a great qualified lead, there would be nothing to build.
That's true. We got to create the awareness to have the right conversation. Thanks again, Rebecca. Thank you for everybody for joining us today. Look forward to seeing you next time. Thank you, guys.
All right. See you next time. Take care.